Hi, I'm Heidi Otway, your host for this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about cannabis as a medical treatment for children, and we have two guests who are very knowledgeable on this topic. Dr. David Berger is a board certified pediatrician based in Florida who owns one of the few medical practices in the state that certifies children to use medical cannabis. Dr. David, please tell us a little bit more about yourself and your expertise.
Absolutely. So I'm a board certified pediatrician, as mentioned, since 1997. So it's coming on 25 years now. I've been interested in natural health and plant-based medicines for a long time. I've been using various herbs and supplements in my practice since back then. So when medical cannabis came along in 2016, while many doctors were very confused or concerned about it, for me, it was just another herb because I had been using different types of remedies like these for plant-based for almost 20 years at that point.
Good. Well, we're so happy to have you. Our other guest is cannabis advocate and consultant Andrea Anderson, who's worn many hats in the cannabis industry and is also the mother of a son who uses cannabinoids. Andrea, welcome to the program and tell us a little bit about yourself.
Thank you so much. Thanks for having me. My journey, I'll try to make this brief. I got started about 4.5 years ago when I became a patient myself and started learning more about cannabis as a medicine versus a recreational product. At the time, my son, who has pretty severe ADHD, was on a few different medications, one for his ADHD and the others were to combat the side effects. So I started researching about cannabis in children, and it just kind of took off from there. I've worked in dispensary. I opened my own cannabis clinic. I've been at the Capitol advocating, helping families all over navigate the pediatric cannabis world in Florida. And my son's doing wonderful now. He's been using cannabinoids for 3.5 years and not any pharmaceuticals. So it's been a pretty amazing journey for us.
Well, great. We're going to explore more of that in this conversation, and we thank you both for being our guests today. To everyone joining us on this live forum, please share, post, and tag a friend on Facebook to have them join this conversation. If you're on YouTube, share the link so others can join us in this conversation. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them, or the Mary team will respond in the comments. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after this live program. Your name will be entered into a drawing on September 9th, 2021 to win a $100 gift card provided by one of Mary's partners. Now let's dive into this conversation about children using cannabis as a medical treatment. Dr. David, I'm going to start with you. And, giving medical cannabis to children with chronic conditions is nothing new. Can you share the story about Charlotte's Web, which started the national movement to legalize medical cannabis in the U.S.?
Certainly. So Charlotte was a little girl who had a very severe epilepsy condition. The Charlotte's Web product itself was grown to be a high CBD, very low THC product. It was originally featured in the 2013 CNN documentary, and that's really where the national exposure became to when this child, her doctor, her parents were documenting significant reductions in her seizures when she started using CBD.
So what are some of the common medical conditions that make parents consider cannabis as a treatment for their kids?
Yes, epilepsy is certainly one of them. The diagnosis that I have probably worked with the most is autism, in particular helping their aggressive behaviors or irritability behaviors, hyperactive behaviors. Kind of the behavioral realm seems to be a very big issue there. I have more in the teen realm in terms of depression and anxiety. That's been a big helper there. I do also have some patients who have different types of autoimmune diseases. We know that cannabinoids have a really wonderful anti-inflammatory effect that doesn't cause a lot of the problems that anti-inflammatory medications can cause, and it can be really helpful in those types of conditions as well.
So I want to go to Andrea. Andrea, what prompted you to consider cannabis as a treatment for your son?
Well, cannabis I was able to successfully get off my antidepressant and anti-anxiety medications. And with my son, it was a constant struggle of finding the right medication, finding the right dose, adding medications because, the Adderall caused a myriad of side effects. And so I just wanted to find another route that might be more natural, less long-term harmful effects. And I happened to stumble upon a wonderful nonprofit out of California called Whole Plant Access for Autism. And that just really opened the doors. And I realized that this wasn't just something that could help ADHD, it could help a lot of other conditions. And it just kind of snowballed from there.
Dr. David, is this a common story that you hear from parents that come to you seeking help?
It is. And, I realized that at first thought when a person would say, wait a minute, you're giving a kid who's having attention or issues, you're giving them cannabis, because there's certainly a belief in our society that it'll make people more of a space cadet. And in fact, I found quite the opposite. One of the most common side effects of medical cannabis is lowering of other medications or getting them off. And I have seen scores of children who, with using the proper types of mixes and balances, which we can certainly get into more later, have been able to come off of medications like their stimulant medications, and they're doing significantly better as well. So yeah, this is a very common thing, and I've seen this firsthand.
Well, I like what you just mentioned about, the different CBDs and all of that, because in my initial thought was like, what kind of products do you recommend a child use? Because it's obvious they don't smoke it.
Right.
Should not smoke it. So
right.
Tell us a little
They're not
bit
allowed to purchase flower. Yeah. Right.
Yeah. So can you talk about that, the kinds of products that children actually use?
Absolutely. So my first recommendation, and this is true for adults also, is to start with CBD. Okay, and we gradually work up the dose there. I give them dosing regimens where we're increasing the dose every several days and logging it properly. We will work up to a maximum dose, usually around 50 milligrams each dose if necessary. And then, pardon me, then if the patient is not getting the relief that is being sought, that's when we will usually bring in the THC products. We always encourage people to use THC and CBD together because of how CBD can lower or completely stop the intoxicating effects of THC. But we also use THC when we bring it in a much smaller starting dose, as well as a much smaller jumping dose as we make the incremental climb as necessary. But in addition to that, it's also, especially when it comes to THC products, the different types of strains and the different types of terpenes is really, really important. I have found that products that go more into the sativa realm, and as many people know, sativa is more stimulating. That's how I remember it when I teach people sativa stimulating as a way of remembering it. That there's the terpenes that are in there, and the one that I have found the most helpful, which is called limonene, has stimulating effects, and we know that stimulant medications are a mainstay of treating for this. So I think that the benefit that people are, especially from a sativa product, is in that same realm because it is having some of those stimulant type of effects.
So as I'm hearing all of this, it sounds like any parent that's listening, you need to actually find a physician, which is part of the process of getting, medical marijuana in Florida. Can you talk about the steps that a parent would take to find someone like you that could help them navigate this? And then I'm going to go to Andrea to talk about, her experience and what she's hearing from parents who reach out to her. So Dr. David, what are the steps parents should take?
Yeah. So, obviously it is a challenge because not every cannabis certifying physician is comfortable seeing children. So the number of physicians who certify in the first place is very low. There's really only a couple in the Bay Area. And in terms of actual pediatricians, I'm only aware of 2 or 3 in the whole state, which of course makes it a challenge because as part of the law, there needs to be a face-to-face same room evaluation that's performed. So what I'm also able to do in my practice is I actually developed an educational practice. So if people are getting certified with their children certified elsewhere, they can still use me as an educational consultant where I can give them all of the same education and all of the same information. So at least I can help people out if they have a kind doctor who's willing to give them the formulation, the authorization, but they don't necessarily know how to handle it, then I can offer that as well. Now, as far as what the law goes, so the first part about the law does say a qualifying condition. Okay. Right. And that's an important thing to understand because as many people remember, and I realize each state is different, in Florida, we voted, there were 9 different diagnoses plus this 10th thing that said similarly debilitating condition. Okay, so ADD, for instance, autism was not one of the actual listed there. But what I said is, well, what is considered a debilitating condition? That was the first part of my thought to myself. And to me, a debilitating condition is where you have to do something on a regular basis to overcome it, whether it's taking a medicine, whether it's talk therapy, behavior therapy, physical therapy. One is as obviously it's debilitating if you have to do something that most people don't have to in order to treat your symptom in the first place. So then what I did is I went through the different diagnoses that were approved. So what are the debilitating symptoms seen in PTSD, anxiety, panic attacks, depression, insomnia? So people who would have those types of symptoms as part of their autism, say, then they would have a similarly debilitating condition to PTSD. Mm-hmm. The one that I actually had the most difficulty finding was figuring out was for ADD. And then I discovered that there is an actual diagnosis called HIV-associated neurocognitive disorder. Mm-hmm. Now, HIV is one of the conditions, but if you look at the symptoms of the neurocognitive disorder, the first 3 symptoms listed are hyperactivity, inattention, and lack of focus. Mm-hmm. And I'm like, well, if that's not ADHD, then I don't know what is. So that's how I was able to make a similarly debilitating condition. And if for that matter, if a person's having to take a narcotic, a stimulant medication in order to overcome it, they obviously have a debilitating condition that's leading it to use a scheduled pharmaceutical agent there. So that's kind of how we kind of connected all the dots.
Okay, so Andrea, when he was speaking, I saw you nodding your head. Do you want to follow up on what he just shared?
Well, I mean, as far as
from the parent perspective.
Yeah. Well, it's challenging for families in Florida for the reason that there aren't a whole lot of physicians, like we had mentioned before. There aren't a whole lot of physicians in the state that feel comfortable or have the knowledge and experience to treat children. And so a lot of times I will get parents that are reaching out trying to find a doctor in their area. And that is the challenge. I send a lot of them to Dr. David because he simply is the best for children. And if they can't make it to Tampa, getting them certified and then being available to them for the education part is kind of where I come into play. Just kind of guiding them along and getting them the resources or the access to the resources and the research that they need that they won't necessarily find if they've just got a physician that can write the recommendation but doesn't really have a lot of experience in treating their child's specific condition. So it is a lot about education, and there's definitely not enough of it.
Yeah, and I want to touch on something. There's a lot of nuances to the terminology that's used when talking about Florida's medical cannabis program. And, doctors don't prescribe, and you use the term recommend, and you use the term certify. So, Dr. David, can you kind of clear up or educate our parents and others listening on that process of not prescribing, but the certifying and the recommending of medical cannabis?
Yeah, sure. So part of it, in all honesty, is a workaround relative to the federal law. Okay, because federally speaking, this is still illegal. And from a doctor's perspective, there was a concern that if we were using the word prescribing, that can go right up against our DEA, which is federal. So the 2 terms that I use are authorize and certify. What the state law says is I'm certifying that a person is able to go purchase it on their own. They obviously don't go to a pharmacy, which is of course the only place you can get a prescription. But they can go to a dispensary if the parent themselves, they have to have a caregiver card. so that a child's allowed to have 2 caregivers because they're obviously not driving to, transporting, purchasing, and administering it especially for young children, for themselves. So that also means that the parents are the caregiver. If a child is getting it, it's only coming from that way. So a kid isn't just walking into a store, a teenager is not just getting it on their own. That can't happen until they're an adult. Right. Now, so that is kind of how that works. But also in the pediatric realm, the law also does say that there needs to be a second physician who writes a letter that has to be put on the chart that basically agrees that the benefits for the child outweighs the risks and for what the diagnosis is. So, in our practice, we have another physician who works for me that does that. I also do serve as the second doctor for a lot of other physicians, especially they feel comfortable more having a pediatrician as the second doctor on their chart, kind of as a little bit more support for them. So that's another thing that I'm able to offer for people, is to serve as that second letter doctor.
Yeah, that's good. Thank you. So we're starting to get some questions from the audience, but I want to throw out some of the comments. So before every conversation on cannabis, we ask people to send in some questions or share some comments on the topic at hand. So I want to share this comment that we got from Mr. Darian. It says, my sister was diagnosed with autism and epilepsy. She hates taking medicine, but the use of marijuana in the form of edibles has helped her. Do you all see more kids, using edibles? What are the more common products? You mentioned CBD. Is it in the form of edibles? What do they use?
Why don't you take that, Andrea?
There are products out there that you can get, edibles with CBD or low THC. As far as what's available in Florida, to my knowledge, there aren't a whole lot of products available in the dispensaries that offer edibles with low THC. Most of the edibles are high THC. But I think the edibles are a great option for pediatric use because it can be challenging, especially if you've got a child that doesn't like the taste of the oils. Doesn't like swallowing capsules, isn't comfortable with, inhalation because they can vape if they, the cartridges, the oils, they can vape. So it's another route that they can use, and it stays with them longer. So, if you've got a child in school, they take that dose of the edible of whatever form in the morning, that's going to stick with them for 4 to 6 hours usually. So that's a good long lasting to avoid, needing a midday dose, which can be challenging in a school environment.
Yeah, that's a really good segue into my question about, school starting as we're recording and doing this live program. So what are the state rules that guide legal medical cannabis use by students? It's illegal, right, to have it on campuses?
Okay, so and also one other thing I like to add is, so it's not allowed to be dispensed. Obviously, a kid's going to walk on campus if they take it beforehand. It's in their body, so it's in campus, on campus. Right. Another option that's also available are patches. There's several different dispensaries that have patches, so applying it before the child goes to school, then there's no dispensing, administering while they're in school, and those can easily last throughout the whole day. So there's that option. Now, the part of the challenge is this. So parents have been able to go onto campus, sign their kids out, take them off of campus, administer, bring them back. That's how most people were doing it. Now, back in the winter of 2019, so prior to COVID, the State Department of Health and Education had requested every school district to submit a plan for allowing the administration on campus. And most of the districts came up with plans that there would be a specific room that the parent would be able to go on campus, administer, not have to sign them out. But the nurse can't be the one who's administering it like they would for Ritalin, etc., because you have to be a caregiver. And you can't be a caregiver for 600 kids because that's not part of the law. So, but the unfortunate thing is that right after the week that those submissions needed to be placed, which I believe was New Year's of them, COVID hit the next month. And, so to the best of my knowledge, none of these rules actually ever went into place. I understand how the Department of Health and the Department of Education got some kind of more important stuff on their hands once COVID hit. So, I have grace on them for not putting that forward, but, that's still out there. So I've seen some schools that are allowing that now, but there's not a a one right answer right now because it never got to that point.
Wow. Okay. Well, we are starting to get in some questions, and we have one with someone asking, what is the youngest age you have administered and in what form? And before the forum, we did get a comment from a parent who said that their 3-month-old was actually using cannabis at 3 months old, which I thought was really interesting. So, Dr. David.
Yeah. So the youngest that I have is under 2. This was a child who had brain cancer, who was not doing well at all with the chemo, and it was really brought in as a way of helping her through that, which is, cancer is one of the diagnoses that was part of the original law. Yeah. And so, getting her through the chemo, but still she's using it now and continues. And now, like, she's like 5 years later, she's had no breakthrough regression. And she's been staying into remission. So that's the youngest. Obviously, I don't know what the medical condition of the 3-month-old was that got to that. I also don't know in Florida and how they were doing it.
The parent just said medically fragile.
Yeah.
No specifics.
Right. So obviously, if there was a 3-month-old and there was a condition, that kid was having epilepsy, and it was, well, first of all, I would be trying CBD before I would try THC anyway. Mm-hmm. But my philosophy is you got to, we always weigh the risk versus the benefits. That's what informed consent is all about. Mm-hmm. And with everything, we have to ask ourselves, well, what are the pros versus cons here? And if sometimes there are no other great answers. Sometimes there's no great answers. But then you have to say, but what is the best answer?
Yeah. Yeah. And Andrea, I think you can talk to that because you had to weigh the pros and cons with your son.
Absolutely. And it is a challenge. But I think that a lot of parents, when they make that decision to even question or look into medical cannabis for their child, a lot of times it's a last resort because nothing else is working, or it might be treating one symptom but it's causing a whole slew of other symptoms, and it's just a never-ending battle. And so you do have to weigh the pros and cons. And with a lot of these children, they're on some pretty heavy-duty medications that, I mean, for me, it was a no-brainer that the risks and, the risks outweighed, the benefits outweighed the risks. So it's a very individualized basis with every child. And I think that, it's easier for some than others, but you really have to look at the big picture and look at, each child individually and determine that based on your own feelings, what you feel comfortable with, and what science is saying.
Right. We're getting some more questions in, but Dr. David, I want to have you kind of educate our listeners and viewers on the cannabinoid system. We've had previous shows where we had doctors just kind of give a whole overview about the cannabinoid system. And I think it would be good for you to do that now before we kind of go into some of these questions that we're getting from people who kind of are asking questions about the different types of cannabis they should consider. So can you tell us a little bit about that?
Absolutely. So the first part of this is understanding that not just humans, not just all mammals, all vertebrates, and even some subvertebrates make cannabinoids, which are called endocannabinoids, endo meaning inside, and have endocannabinoid receptors. Mm-hmm. Okay. So our bodies make these things. So it's very apparent to me that we wouldn't have this system if it wasn't a good thing for us. We wouldn't have evolved that way. Okay. So our bodies make 2 main cannabinoids, and basically it works in what was referred to as in a retrograde way. So normally, like if this is a serotonin cell, it will send a message over in the brain in particular. I'm talking now with serotonin. It'll send a message over to this cell to then make an action happen this way. What happens with the endocannabinoid system is this cell over here is actually monitoring what this cell is doing. So in a case of a seizure or a case of an explosive behavior or an anxiety, when this cell is not being stimulated properly, or in that matter, in a pain situation where this pain cell is stimulating this cell too much, the second cell actually sends a message back over the synapse to the original cell, basically saying, calm down, chill out, stop doing this to me. Okay. And that's what the endocannabinoid system is. Okay. So the plant-based cannabinoids work stronger than the human-based ones. The most part, CBD, one of the main things that it does is it slows down the breakdown of our natural endocannabinoids, keeping it around in that synapse longer because it gets sucked back up one way or the other. So the analogy that I made when I came across this several years ago when I had my kids bowling. And, when we bowl, unless you're really good, eventually you go too far left, you too far right, you go in the gutter. Okay. And that's one of the things about the cannabinoid system is that if your body's too far this way or too far this way, it can help bring things back. So when the kids would bring their little rails up, if you went too far left, there was something that kind of pushed you back towards the middle.
Right. And
so I'm watching this. I'm like, hey, that sounds a lot like our endocannabinoid system. And then I said to myself, well, what about the plant-based cannabinoids? And then I realized, well, sometimes, if you roll a really bad ball, you may even hop over that rail. Or maybe you have one of those big Indiana Jones bowls rolling down and it ain't going to stay in there. So the plant-based cannabinoids are basically giving you bigger rails, allowing more to kind of, more help in pushing you down the middle. And so, so that's my analogy, and it actually works really well for this.
Oh, I'm a bowler. I thought that was outstanding. So thank you for sharing that. So now I want to bring in a question from Lisa that's asking, what are your thoughts on full spectrum versus isolates? Do you find that one works best for certain conditions, people or certain conditions? So that goes to that analogy about the bowling, I would think. I'm sure you could tie that in, right?
Right. Andrea, do you want to talk about that?
I mean, I personally am a huge fan of full spectrum. I think that, not everybody, but people learn about the entourage effect and the different cannabinoids within the cannabis plant and how they work together. And, they work in a synergistic way. And so with a small amount of THC and other cannabinoids, you're only creating a better environment for better relief and a better reaction from the cannabis. So I am very pro full spectrum.
So what does full spectrum mean? That you're using a combination of?
Yes. So in terms of, like CBD, for example, it's going to have a small amount of THC. 0.03 or 0.3% is, 0.3% is the federal limit for THC. And then it'll have some other minor cannabinoids in there as well.
Okay. Dr. David, you want to talk about the isolates?
Yeah. So an isolate basically means they're just isolating the THC. Okay. And they're concentrating that. Okay. And there are some concentrates where they will also have some terpenes put in, but there are many, many, many different ingredients within this plant. Yeah. Okay. And, there are many minor cannabinoids, CBN, THCV, THCA. You'll hear about all of these things. So, the way I look at it is that nature put all of these things into plants for a reason. And they put it into this one plant. It put it into plant for a reason. And we know how things usually go when we try to tinker with Mother Nature. Mother Nature usually wins out. And so the way that I look at it is that even if we don't have a full understanding of what each of these cannabinoids are, I think that what has been developed, evolved over millions of years, thousands of years, however long you wish that they think that we've been here for, that this has grown into a way. So why would we not use the advantage of the full plant medicine? And so that's really what they're talking about.
Okay, well, I'm going to jump to a question that we received from someone who registered for the program. Crystal says, we give our daughter high quality CBD. We've experimented between full spectrum and broad. Can you give some clearer information on what would be better for focus for ADHD for elementary age children? She also has a follow-up question, but let's answer that one first, and then I'll give you the second question.
Sure. Andrea, you want to start on that one?
Well, my son has ADHD. The two cannabinoids that we use primarily are CBD and CBG. He takes both of those on school days sublingually. That's what we've used for the past 3 years and has worked well for us. He actually doesn't need any additional CBD or THC other than what's in his full spectrum CBD tincture.
Okay.
Yeah. And to answer that question also just a little more specifically, it's not really a completely fair question because that's like saying which is the best treatment for ADD. There's
Right.
stimulant medications, there's non-stimulant medications. Some people use blood pressure lowering medications. So it's such an individualized thing, and there's a lot of trial and error. So that's also part of our education process, is explaining to how to properly log these what are you doing, introducing them one at a time, or a particular strain. I can have one person who tells me that this strain is like the bomb for this, and then another person will say that was the worst strain I could have imagined. Why would you even suggest that to me? And so there is too much person to person individuality that if anybody says this is the best strain for this person for everybody, they kind of don't know what they're talking about, because it's too individualized for that.
Right. And then that actually goes right well into her second question. Her second part, she says, my daughter seems to do better on full spectrum. So they've kind of figured out what works for her daughter. However, there's so much controversy with THC in younger children. And then she says, how does small amounts of THC really affect our growing children's brains? Is it safe?
Good question.
That's a great
question. First of all, there is a true dearth of research into this question, because we haven't been able to. And I understand from an ethical perspective, it's not going to be like we're going to do a double-blinded controlled study where we're just going to randomly give all these kids THC and these not, and see where they are in 18 years from now. So I realize that we're not going to get the exact right answer that we're talking about. But it does seem pretty clear that there is an impact on memory and cognitive function. The more that is used and the earlier that it's used, it seems to have more of an effect. So even, brains are not fully developed until 22 years of age.
Right.
So the earlier that it's happening, that will have more of an impact on it. And that's the reason why, we say try the CBD first, because you might not need THC in the first place. But also by doing that, and you probably don't need as much THC if the CBD is there anyway. So when we start off on adding in the THC, we're literally adding like 1 milligram as a starting dose, which and after that we go up to 2 milligrams. So which is also tough, because a lot of the products, gummies, capsules are at least 5 to 10 milligrams, and so that's where tinctures can really be so helpful, because that's really the way to get down into the small doses.
Mm-hmm. Well, we just got a question from someone, Maureen, asking, are there any studies on kids using cannabis products? And is there, can you, where can I read up on these studies somewhere?
Probably Israel is who has done the most research on it. Dr. Mnuchin, I believe is his name, has been really the especially in the autism world, has really been the main. But again, there's just not a lot. But certainly, what I always like to do when I'm looking for medical studies as opposed to just opinion pieces, because we don't quite know how those opinions were formed, is whenever I do a Google search, I'll put the word PubMed. PubMed is the international repository of all medical studies. So if I'm wanting to look at like medical cannabis and autism, PubMed, then I actually get to see the studies that were done. And then, you may find review articles, meta-analyses, which is looking at many articles all together. And so I think that gives a lot more, and I don't expect everybody to be able to sit and read a full medical study the way that somebody who's trained to do that is. But, just reading the abstract, reading the discussion at the end, you can certainly look up to see, well, how do they actually do this? But that's how you can really start to look at the research better and to try to figure out, does this make sense for me?
Good. So I want to kind of get into questions that I'm sure parents are probably asking. And Andrea, I know you could probably give us some insights on this, but what about the stigma that may come to a child, because we're talking about children, so we're talking about 18 and under, and they're using medical cannabis because they have a qualifying condition. How does that impact the child? And first of all, how do you have that conversation with your kid to say, hey, I think we're going to put you on cannabis or marijuana? How did that go?
Well, for me, my son, he had just finished second grade. We took the summer to wean off of his pharmaceuticals and introduce the CBD. And it was, I don't know how I just kind of said, okay, we're going to try something new. This is a different kind of medicine. He said it tasted like dirt. I said, well, that's because it comes from the ground. It comes from a plant. And I had to tell him at that point, this was 3.5 years ago. I was not nearly as vocal about my own personal cannabis use, let alone his. So I did, you got to kind of keep it hush hush. There are people that don't know about this as a medicine. They don't agree with it, so just kind of tread lightly. He is a medical patient, so we are legal. It's okay. And then the conversation had to evolve. Once flower was passed in Florida and I started purchasing whole flower, he actually saw me outside smoking flower and thought I was smoking a cigarette. And so I didn't want him to think that I was smoking cigarettes. I wanted him to know. So that's when I introduced him to flower. And I said, well, this is actually where your oils come from. And, I showed him the flower, let him look at it. And so he's actually gotten to know quite a bit about it. And he looks at it as a medicine and not so much the recreational stigma. He really doesn't see any of that yet. And he might as he gets older. He's only 11 now, but it's been a great opportunity for us as far as like reducing that stigma and normalizing it.
Right.
So I think I would encourage parents to have that conversation and not just, dumb it down to where, oh, we're just giving you another medicine. Let's be honest about it. It's plant medicine and it's okay. That's my 2 cents.
Dr. David.
Yeah. And, I also explain, I am a pediatrician, or this is something that a doctor is recommending for you when weighing the pros versus the cons.
Right.
Another thing that I've also learned during haters are going to hate. Okay. And everybody's got an opinion. And, I've kind of gotten to a point, at least in my career, where I don't have time for all that. There's enough people who need my help that I'm willing to give it to them. But, one of the, it certainly has become more acceptable. I mean, even medical cannabis, when we voted, it was like over 70%. Now it's over 80%. I mean, probably the only thing that's more popular now are puppy dogs and Santa Claus. So, it's not the same stigma that it was 5 years ago even, but open, honest talking about things. Kids learn, kids are smart. They hear things at school. They're going to know about it, but, hey, are you, to the kid, I'm asking, well, how do you feel? Are you feeling better? Are you functioning better because of this? Or, obviously for a kid who's verbal, it says, but, or like when somebody would ask a parent of a kid with autism, well, how is this child with or without this treatment? And obviously no parent is going to keep on giving it to their young child if it wasn't helping.
Right.
And so there's a nice filter right there. And so each of these parents are weighing the pros versus the cons to make their decision.
And I think another little tidbit that I want to throw in there is we're not using this to get our children high. We're not intoxicating them. The whole point is to find a therapeutic dose that is below that level of intoxication. So, I mean, it's not what some of those people think. It's not. They're not smoking. You can't even get flower for children in Florida. So it's very medicinal.
Yeah. And one of the things we always recommend during the show is we want to encourage people to go to the Florida Department of Health's Office of Medical Marijuana Use, because it has all of the information about Florida's laws, how to legally obtain a medical marijuana card, the steps you need to take. It has the list of the 2,500 plus qualified physicians in the state that are allowed to recommend the product if you have a qualifying condition. So we would encourage folks to definitely visit the Office of Medical Marijuana Use under the Florida Department of Health. So let's shift gears to probably a huge question is, how much does this cost? We're talking about medical grade cannabis. And, if you were to Google search, you'd see people talk about the cost. Andrea, how has that been for you as a parent, having to pay for this medical treatment for your son?
It's tough, to be honest. I was fortunate enough to find a doctor that had 2 recommending physicians within the same practice, like Dr. David. So I didn't have to pay for 2 separate appointments to 2 different doctors, but sometimes families have to do that. Mm-hmm. I pay for not only my son's card every year, but I also have to pay the same fee for my caregiver card. As far as product in the dispensary, insurance doesn't cover any of this. So everything is out of pocket, and it can be a challenge. I usually recommend that parents, pay attention to the dispensary sales. They do run sales. Some of them offer pediatric discounts. So it is a challenge. It can be, it can be very tough for families, especially for some of the families that only have single income households, because they have one parent that goes to work and the other parent stays home with the child. That can make it very tough.
Yeah. Dr. David.
Yeah. So part of the reason why we also strongly encourage people to start low, go slow, one at a time, is to find the therapeutic dose where not giving too much that's going to cost more. Okay. When people ask me how much is this going to cost, I say to them, honestly, it really depends on how much your kid needs. Because let's face it, if a kid needs 10 milligrams twice a day versus 30 milligrams twice a day, well, guess who's paying 3 times as much, right? Because that's just math. So there's that aspect that, a lot of the dispensaries will even have these flash sales. So if you sign up for their text list, they'll even send it out like right away. And this is for the rest of the day. A lot of the dispensaries will even stack some of their discounts. So if there's a couple that they qualify, that they're allowed to do that. Many of the dispensaries will also give a credit to pay them back for the card that they get from the state, so they can get like $75 towards a purchase. So there definitely are ways of reducing the cost, but unfortunately, it's not like where you have a no copay on a medication and you just get it for free. I mean, that would be glorious if one day we got to that, but I don't see that happening anytime in the near future, at least.
Okay. We got a really interesting question from an Ashley asking about children who are in the welfare system and having and needing medical cannabis. So here's the question. How does the law handle children who are involved with the child welfare system if they're removed from the home and foster parents can't be available during the day to administer? Can a paid provider administer in the schools? How does the law work with children in the state welfare system being certified and using medical cannabis? These children are often our most vulnerable when it comes to ADHD and other diagnoses that qualify them for certification. Really great questions here. And Dr. David?
Yeah. Okay. So it still comes back to who has a caregiver card. Okay.
Let's bring that question up because it was pretty long. It was like 5 different questions.
Yeah, it was. Okay,
yeah. So let's leave it up for a little bit.
So in terms of the availability to administer, so realistically, the way it is right now, so if the family has somebody else that can get, that will be one of the 2 caregivers that gets a card, then that person can be the person who goes to administer. I realize that's not necessarily the most likeliest or possible or feasible situation, but that would be the answer to that question. So it can be a paid person as long as that person is considered the caregiver. Obviously, the guardianship and, I would imagine, who is the guardian of that child, who has the legal right to sign for medical care, would certainly be, the person who would be bringing who legally can do that would be the person who's bringing the child to the clinic in the first place. And we have to see verification of that, so, again, and it's tough, and I can imagine it because of the bureaucracy that's involved in the welfare system. I could see lots of roadblocks being there. But in our practice, we do whatever we can to help because that's what our goal is.
Yeah. Okay. Ashley, thanks for that question. That was a really good question. So Dr. David and Ashley and Andrea, are there any other things that you all want to touch on? This has been a really lively conversation, and I have a couple more comments that I want to share from folks who registered for the program, but are there any resources that you recommend or any other tips that you want to share with our listeners and viewers today?
Yeah, I definitely have one. It can be very confusing, especially as a parent, of knowing what to give their kid. Okay. And walking into a dispensary can be a very good information or a not so good information, depending on who the person is that you're talking with. Okay. It's also can be very overwhelming because usually there's lines there and there's other people and like you have to make a decision real fast. So I absolutely recommend do your homework first. Go to the dispensary website, see what types of products they have available. I mean, maybe you want a tincture and it shows that they don't have a tincture there. So that's not where the place that you want to show up. Using the delivery systems makes it so much easier because you may find that there are a product from this company that you like and a product from that company you like, and they may be on opposite sides of town, but having the delivery available. But also do your homework overall. Learn more about the endocannabinoid system. Learn more about the terpenes. I mean, we share the terpene wheel, which shows all the different effects of the different terpenes with our patients because we need them to understand that. But then also, hopefully a physician is offering the education and the follow-up information that when a parent has a question that they can call up and say, okay, what do I do now when they're telling me to do this? I mean, I had several patients in the past couple of weeks who first time out and they were given concentrates and like told them put out a little grain of rice, a little bit of drop. But you know what? With a THC containing product, you cannot get a very tiny dose. There's no way on earth you can get 1 or 2 milligrams out of a concentrate such as that. And so, I mean, they bought this thing. They were told this was the right thing to do. And then I'm like, when they say, what should I do? My answer is return it. Start somewhere else. Maybe you will find that higher doses are needed down the line where that may be more convenient. But if you're trying to follow my program, a very reasonable program of low and slow, concentrates are not the way to do it.
Mm-hmm. Good to know. Andrea, any thoughts? Closing thoughts?
I think just, as parents that are taking this journey and starting out, just to remember that A, you're not alone. You're not the only one. B, there is a plethora of information out there, and you just really have to the beautiful thing about cannabis is it empowers us to take control of our own health. And so do that and take the time to research, take the time to ask the questions, take notes. Because you're going to need that. You're going to need those notes to help you understand what products are working, what products are not, what dose is working, how frequent you need to dose, those type of things. And just know that there are good people out there that have the experience like Dr. David, and you'll get through it.
Good. Well, we want to thank you all for being a guest on our show today. And we did have a question from someone just asking about, this was Mr. Wallace saying, how long does it take for a child to go, the process for a child to get qualified or certified to use cannabis? I want to use that as like a closing question. Again, just going back to the process. How long is that?
Okay, so we pre-certify people. Pardon me. We not pre-certify. We review everything that they give us, and we do not schedule an appointment to them until they have everything lined up. So in our office, we need to see medical records. We need to have evidence that this qualifying condition is actually there. So we need that. We don't need a full medical record on our chart, but I need to see enough documentation that says, yeah, this person has this. This is what the child has used, because again, we're supposed to be comparing it to the alternatives that are out there.
Yeah.
So having that and having the form filled out, but like obviously once they come to see the doctor, and of course how their waiting list is, I know mine runs a little bit longer than most, but it's not too bad. Then of course there is making sure that you get that second letter on hand. So again, if a facility has that second doctor on staff ready to go versus I have to now go find another person, that's going to take longer. Yeah. But once and then we, the physician group, has to then put the patient into the medical marijuana use registry,
yeah.
Which that creates a patient number. Okay, then that number needs to be used by the parent to actually apply for the card. So I've had parents who haven't applied for the card, so they're not getting a card sooner. But once they've submitted it, it's about a week to 2 weeks before they get the actual notification, and then they get the card. There's little things such as making sure that in a child, in adults, they're allowed to use a picture from driver's licenses.
Right. Yeah. What do kids use?
Yeah. So they have to have a passport size photo. They have to upload it. That has to be verified as well. So if the head's too small or whatever, it needs to fill a certain percentage of the photo, etc. I've seen many people who have had to do second photos. So so there's definitely a hang up there as well. But it's usually approximately 1 to 2 weeks when all the ducks are lined up.
Okay, so there's the process for parents, and I want to thank you all. This was such great, detailed information that you shared on this Conversations on Cannabis virtual forum, brought to all of our viewers and listeners from the Medical Marijuana Research and Education Initiative at Florida A&M University. So thank you all for being our guests. I also want to thank everyone who's watching this program. Please tell us what you think about this forum by completing the survey that will be posted on the comment boxes on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on September 9th, 2021 to win a $100 gift card provided by one of Mary's partners. We again want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn more about how to attain legal medical marijuana in the state of Florida. And we also encourage you to go to the Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thank you again to our guests. Have a great day, everyone.
Have a good day.
All right, thanks.